The very worst of this coronavirus pandemic is starting to unfold in the US right now. 2,800 people have died there just in the last 24 hours. Many hospitals are close to capacity and infection numbers are skyrocketing. Dr. James Lawler is with the University of Nebraska Medical Center and he joins us now from Omaha, Nebraska. James Lawler, welcome. So 2,800 people dead in a day, and I understand you've had COVID patients yourself, so you've been on the front line of this. How would you describe the situation unfolding there right now?
Well, it's very concerning here, and I think we're all worried about the increase in cases that we anticipate will come from the recent Thanksgiving holiday. So last Thursday, was American Thanksgiving, and it's a time when Americans traditionally get together with family. It was the largest travel day in the U.S. since the pandemic began, and I think all of us are very concerned that that may result in an acceleration of cases. We've already seen a pretty significant fall epidemic wave here, particularly in the Midwest, but now that epidemic wave appears to be more severe in some of the states that had relatively significant experiences in the spring, but managed to do well in the summer. So states on the East Coast, states on the West Coast. Now it seems that the entire country is really starting to be on the upswing. So it is very concerning, and certainly our ability to manage this number of patients and maintain the ability to deliver high quality care is going to be stretched.
And how much worse do you expect it's going to get with the number of deaths per day?
Well, unfortunately, I think we're really just starting to see the acceleration in deaths that we'll experience over the next month or two. It's true that here in the U.S. and really everywhere that has experienced epidemic waves, deaths tend to lag behind case numbers by 3 to 4 weeks. And so we're seeing now the effects of case counts that were occurring in early November. And obviously we accelerated quite a bit throughout November. So I anticipate, unfortunately, that our death toll will continue to go up.
And so 270,000 dead now in the US through this pandemic. What will that death toll likely be by the end of February?
Well, tragically, it looks as if we will probably eclipse 400,000 and perhaps more. It really depends on what actions we can take collectively now and whether we're able to tamp down community transmission rates. If we are not, and we continue to have increasing rates, then I'm afraid that death toll could reach 450,000 or even higher by the end of February. It really is a dire situation.
US authorities have had many months and experience with this pandemic now to work out the best way to approach this to limit the deaths. How has it come to this in the US now with this catastrophe unfolding?
Well, it's a combination of many factors, but obviously the most basic is we have not implemented the types of community mitigation, non-pharmaceutical interventions that other countries have been able to do successfully. That's everything from widespread use of face coverings in public to avoiding mass gatherings to dining in restaurants and bars where people are unmasked. Those are the basics of controlling the epidemic that we've not been able to do. It's also true that the U.S. has really, to a large extent, ignored its public health infrastructure for decades now and allowed it to attenuate to the point where we are struggling to do the basics of public health, case tracing, contact investigation, and all of those things have combined to create a bad epidemic situation in the fall.
And to what degree is the president culpable for what's happened?
Well, certainly, I think there has been, an absence of leadership at the national level, and states and localities have been left to manage the situation on their own, and that has to have made a significant impact. So I think that is certainly one of the ingredients of why we are where we are.
On occasion, has it been more than an absence of leadership?
Well, certainly there's been contrasting and conflicting messaging that's come from the federal government, and in some instances from the White House itself, where one would hope that they would set the example for doing those basic things like wearing face masks and avoiding large gatherings, and obviously they have not set the example there for the rest of the country.
And as a doctor, how have you felt about what's happened with that absence of leadership? As someone who's on the front line dealing with people who have this disease and witnessing the devastation on the ground, how do you feel about what has happened in terms of that absence of leadership?
Well, the entire national response has been frustrating. We should not be in the situation where we are now. And many other countries have managed to control epidemic transmission and to contain spread within their communities and to get back to semblances of normal life. I think we can look at Australia as a great example of where successful action of the government and the communities working together can really control the spread of this pandemic. But it's been frustrating to witness how we've been unable to do that.
Will the likely Pfizer vaccine have any impact on what will unfold there over the next 3 months or so?
Unfortunately, I'm not sure that the vaccines are going to be here in time to make a huge impact. It's true that I think we'll start rolling out vaccine this month. I think the best estimate is by the middle of December, we'll have emergency use authorization. We'll begin vaccinating healthcare workers and highest risk residents of long-term care facilities, but it will take us until late January to complete that first tier of immunization. And I think by that time, the majority of damage may already have been done unless we're able to, again, take definitive action to reduce transmission.
Yeah. And a bit of concern there today about the supply chain for that Pfizer vaccine. Are you aware of those concerns, and does that raise any broader concerns for you about what's going to be possible with those vaccines?
Well, certainly it does create some concerns about how rapidly we'll be able to roll out vaccination of those first tier personnel. I understand there's some issues in terms of some of the ingredients that went into some of the first lots, and we may not have quite as much vaccine available as we thought we did. There's also the logistical challenges of cold chain and distribution with these vaccines, so that is going to be an additional challenge that we're going to have to address. So we certainly can use every bit of help that we can right now, so any setback is obviously disappointing.
And you'll have a new president in a couple of months. Is that likely to change much?
Well, I think that the new administration certainly is taking a very aggressive posture already in developing plans and working towards the transition. But again, by January 20th, it's going to be very late to change any of the damage that's been done up until then. I think certainly, more directed in leadership and coordination from the federal government will help with the spring. We're certainly not going to be out of the woods by the end of January, and I'm hopeful that a new administration may be able to create a more coherent national plan going forward. But again, I think that's not necessarily going to help us here over the next couple of months, where we're really going to have a pretty rough go of things.
Yeah. And you mentioned fundamental to changing the approach in the US when you have to confront the future pandemic will be a much more effective public health system. Explain for people who aren't experts what you mean by that. How has public health been neglected in the US, and what needs to change practically with that?
Well, public health is really a state-run function at the end of the day in the U.S., state and local. And so the funding of public health authorities really comes mostly from the state and local level. And that funding has been, I think, woefully inadequate over the last few decades. And our ability to maintain robust public health infrastructure has been impacted significantly. I think we also have other issues in our public health system around adoption and implementation and integration of new technologies, which really should be part of our public health response now and aren't. I think we're well behind many countries in Asia that have implemented better information technology systems in their public health response. And so I think we have a lot of work to do to rebuild a robust public health system moving forward.
Yeah. Okay, James Lawler, yeah, I feel for you over the next few months. It just sounds like it's going to be diabolical there in the US, and yeah, you're on the front line dealing with this, so good luck with that over the coming months.
Thanks very much.